Hello and good evening. I'm Melisa Idris.
I'm Sharaad, Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Tonight on the show, we're going to be looking at Vietnam's response to COVID-19, which has been touted by many as a success story. Vietnam shares a long border with China, which made it one of the first countries to have a confirmed COVID-19 case outside of China. However, so far, Vietnam has recorded only just over 300 cases and 0 deaths in a country of nearly 100 million people. Now, nearly a month has passed since its last community transmission, and the country has already started to open up. So joining us on the line to discuss Vietnam's approach to the pandemic is Dr. Huong Le Thu, Senior Analyst at the Australian Strategic Policy Institute based in Canberra, Australia. Good evening. Welcome to the show, Dr. Le Thu. Now,
thank you for having me.
A lot has been said about Vietnam's success in dealing with the pandemic, but I think we should probably begin by looking at the reliability of the data. Now, the government's data was so strikingly low that there are inevitable questions about whether it's accurate. Are there reasons to doubt it?
I haven't been conducting the research and data, so I can't say for sure. Obviously, there are some possibility that there are some cases that are not recognized or not detected. There's no way we can be sure 100% of data, but I don't think there is any reason to be doubting this data. These data are not only from the Vietnamese government; they are confirmed by Johns Hopkins hospitals, by international institutions, by epidemiologists and other Western and international and global institutions, medical institutions. So I don't think there is any reason to doubt those data. There is no, Vietnamese government has not been concealed. It has been very transparent from day one and very rigorous. So I think the probability that the data are missing or concealed are pretty low.
Dr. Le Thu, I mean, many countries around the world are trying to control the narrative on the pandemic within their own borders. And I wonder to what extent this is true of Vietnam. You mentioned, the many institutions that Vietnam, the government at least, is engaging with. Could you give us a sense of what kind of commitments Vietnam has made to international multilateral organizations that have enabled or actually promoted this kind of openness with regard to the situation on the ground?
Well, I don't think it is really to put this pandemic and reaction into the perspective of politicizing or changing the narrative is the wrong way to approach it. I think some countries have adopted that strategy, but I think they have a lot of political agenda to achieve. And that's not the way we should be looking at any pandemic response. Unfortunately, like you said, there are cases happening with the way the narratives are being presented, but I don't think it is a case for Vietnam. Vietnam recognized that the COVID-19 virus was a very serious one from very early on when it was in Wuhan only, and it started to prepare for it to come to Vietnam because as from previous experiences, like with SARS in 2003 and swine flu, bird flus, all around, those things travel. They don't know borders, and it's a matter of time that they come. And Vietnam, being in the region and experienced the previous outbreaks, had been ready for containing and responding to the virus rather than focusing on the political narrative.
Okay, so you're saying that Vietnam's, Vietnam learned its lessons from the previous SARS epidemic. Could you talk to us a little bit about how its public health response has been, particularly in terms of, whether Vietnam has invested quite a fair bit in its public health?
Well, investment in public health, like in many countries, and particularly in Southeast Asia, are still lagging behind. Obviously, Vietnam, in comparison to more developed countries and developed neighbors like Singapore or Taiwan, is still lagging behind. But I think it's about utilizing the resources well and coordinating well. So the pandemic is a crisis, and in any crisis, the best response is to react early, and that's what Vietnam did. And it also is very effective with pandemic with virus, because the earlier you respond, the fewer cases there are, and therefore it is more feasible to control and contain the spread. And that's what Vietnam did. So like you mentioned, it was trained from the previous outbreaks, and also not only with the pandemics and epidemics before. I think that countries in the region, because they often experience natural disasters and crisis responses, they are more used to quick response, coordination, and any emergency response. The key is to quickly react rather than debating which way, because then you lose the golden window of time where the response is most effective. So that's what Vietnam did. It contained the cases. It isolated people who had been either confirmed or came into contact with the confirmed cases very early on. It was very rigorous in testing, and also was able to invent own testing kits. So it was very fast in testing a large scale of people. It didn't have to rely on other labs or international help in this regard, and it developed many additional laboratories that it could conduct testing regularly and on a larger scale. So it was quick response, it was coordinated response, it was building capacity to test and isolate and contact tracing all the cases.
Dr. Le Thu, one of the ways in which people are comparing different contexts, the state of Kerala in India is one example. Vietnam is now becoming an example, New Zealand. The question really is, on what has public policy pivoted? What are the strengths that each of these contexts have? A devolved system in Kerala, but in Vietnam, it's often said that its highly developed network of surveillance has been a key component in the success story. Would you agree to that?
I don't necessarily agree with that, because Vietnam actually, in the earliest stage, the success of containing the spread was not based on surveillance and not on the contact tracing using technology, like, for example, in Taiwan or Singapore, where the act that did the contact tracing was very early on engaged. I think Vietnam, the first reaction was to isolate the cases, isolate the people coming from travels, first from China, but then later on also from Europe, the cases, and just isolate whether the tests were positive or negative. It was mandatory 14 days of quarantine to make sure that symptoms won't develop, even though sometimes, there are cases of asymptomatic transmission. So Vietnam was very rigid in that regard to prevent any possible, even undetectable at the time of screening spread. So it was rigorous. It was quarantine in the centrally administrative quarantine wards, so not self-isolating at home, where people are usually, it can be less disciplined and can go out or can get into contact with other people, neighbors. Vietnam is a very densely populated place. So if self-quarantine at home could further cause dangers for the others, so it was administrated centrally. So in that way, you can really have a control over those who are either affected or potentially affected by the virus.
Okay, Dr. Le Thu, we're going to take a quick break, but we're going to ask you to stay on the line because we want to continue this conversation on Vietnam's response to the COVID-19 pandemic in just a few minutes. Stay tuned to consider this.